Okay, so here's our game plan for this deep dive. First, we'll get a handle on why this specific cancer is such a formidable challenge. Then, we're going to explore the amazing nanoscale toolkit scientists are building and see how that enables smarter, targeted attacks. After that, we'll look at the next frontier in this research and finally wrap our heads around the new era in medicine this could all usher in.
All right, first up, a formidable cancer. We really need to understand the opponent here. Let's break down the unique challenge of what's called triple-negative breast cancer, or TNBC for short.
So it's a term you've probably heard, but what does it actually mean to be triple negative? And more importantly, why does this specific diagnosis present such a difficult, unique challenge for both doctors and their patients? Okay, this slide gets right to the heart of the problem. Think of most modern cancer drugs as keys that are designed to fit into specific locks on a cancer cell. Well, triple-negative breast cancer is so aggressive precisely because it's missing those three common locks. That means many of our best, most effective keys, our best drugs, simply have nothing to latch onto. And because there are no easy targets, we run into some huge problems. TNBC often comes with a poor prognosis. It gets really good at resisting the drugs we can throw at it. And this is kind of fascinating. It's incredibly clever. It can actually change how it eats, how it fuels itself, just to survive and grow. This creates an urgent, desperate need for completely new ways to fight it. So how in the world do you fight a cancer that has no locks? Well, you build a whole new toolkit from scratch. And scientists are doing just that, engineering revolutionary new weapons on a scale that's almost too small to even imagine. The solution is this emerging field called nanotheranostics. Now, that's a bit of a mouthful, right? But the idea is actually super clever. It's a mashup of therapy and diagnostics. The goal is to build a single microscopic particle that can do two jobs at once. It can find the cancer and then deliver a treatment directly to it, a true two-in-one weapon. So what's in this toolkit? Well, it's incredibly diverse. You've got these advanced materials like graphene, quantum dots, and MXC nanostructures that are great for imaging and therapy. But what's really cool is the use of natural polymers. We're talking about materials derived from things like shrimp shells or even the albumin in egg whites. These are used to build the delivery vehicles so the body is less likely to reject them, making the whole thing safer.
And it doesn't stop there. Scientists are creating these custom structures, like micelles and nanogels, that are designed to be smart. They're like tiny little bombs with a specific trigger. They only release their cancer-killing payload when they sense the unique acidic environment right around a tumor. And get this, they're even loading them up with powerful compounds found in plants to give them an extra cancer-fighting punch.
Okay, so having all these amazing tools is one thing. But the real genius here is in the strategy. It's how these nanoplatforms are used to fight cancer in a much, much smarter way. This slide just illustrates the difference perfectly. You see, traditional chemo is like carpet bombing. It hits the entire body and kills any cell that grows fast. That includes the cancer, sure, but it also includes the healthy cells in your hair follicles or your stomach lining. That's why the side effects are so rough. Nanotheranostics, on the other hand, are like a smart bomb. They're engineered to deliver their payload only to the cancer cells, which could dramatically reduce those awful side effects. So how does it pull this off? Well, you can think of a nanocarrier's journey as a precise three-step mission. First, it's injected and circulates through the body. Then, it uses molecules on its surface that act like a homing beacon, letting it find and lock onto the tumor cells. And finally, once it's docked, it's designed to release its cancer-killing cargo only when it senses that unique chemical signature of the tumor itself. And to get past that tough drug resistance we talked about, these tiny platforms don't just rely on one weapon. They can launch a full-on combination attack. We're talking about a 1-2-3-4 punch. They can be designed to literally heat cancer cells to death, or use light to create toxic oxygen molecules to kill them, or deliver a super concentrated dose of chemo right where it needs to go. It's a multi-pronged assault that the cancer just can't easily defend against. So, with this incredible foundation of targeted therapy already being built, researchers are now pushing into the next big frontier, figuring out exactly how these cancers manage to fuel their own aggressive growth in the first place.
Okay, don't let the title scare you. I know it's a mouthful, but the idea behind it is actually simple and totally fascinating. We all know cancers are hungry, right? Well, this specific research is trying to figure out the exact mouth, a specific protein pathway that this cancer uses to gobble up fructose, fruit sugar, as its fuel. Because if you can figure out how it eats, you can figure out how to starve it. It's a huge potential insight.
And to do this, scientists want to use a really powerful technique called radiomics. Think of it like a super advanced PET scan. It would essentially let them watch in real time how a tumor is eating its lunch. By seeing exactly how the cancer is feeding itself, they can pinpoint a brand new vulnerability, a new weakness to attack.
So let's zoom out from the lab for a second. What's the ultimate vision here? What does all of this incredible research actually mean for the future of how we treat cancer? Well, the long-term goal is nothing short of a complete paradigm shift. Imagine a future of truly personalized nanomedicine, where treatments are made not just for your type of cancer, but for your body, using safer, green materials. A future where AI helps us design even smarter, more effective treatments. And of course, the most critical step of all is clinical translation, getting these amazing breakthroughs out of the lab and to the patients who need them most.
So, when you put it all together, here's the bottom line. Nanotheranostics aren't just another small step forward. They represent a fundamental shift in our entire strategy, a move toward cancer treatments that are more personalized, way more effective, and ultimately more sustainable for the future of medicine.
And all of this leaves us with one final, really powerful question to think about. This amazing technology is being perfected to fight one of our toughest cancers. But once we crack it, what's next? What other diseases could these tiny fighters learn to conquer? From Alzheimer's to heart disease, the potential here is just beginning.